I've always been fascinated about medical research and how a key important role it plays on building communities and a society as a whole. It creates advancements in science, which helps us in tremendous ways into our daily lives. And I was looking for a certain platform where I can get to learn more and educate myself about immunotherapy, say specifically because I myself come from healthcare and seeing people every day and meeting patients every day who were very anti-vaccine, who would have these stigmas about vaccinations, their side effects, how it was a conspiracy, certain, false misinterpretations of the whole immunotherapy. So that is where I came across to know about the organization, about the whole, its mission, how it was formed, how it's built, and how Dr. Convitt himself, how he started, how his mission was to break the stigmatization revolving around immunization, and how to just help everyone regardless of any discrimination. And that is those are very like those are certain values that I feel like everyone should have, because I've seen a lot of people where, they were not able to, access, even basic needs just because of the cost and, the socioeconomic status that they had. So that's where I learned about the organization. I volunteered here, and of course, I was working with you, and you've been a great mentor for me. And my knowledge was very limited, so that's in immunization, and that's where I got to know more about vaccines, how it affects the human body, the statistics, its effects, certain types for certain diseases. And it's been overall a very enlightening and informational journey for me. So, this is basically what I felt like in the first part of my presentation. I wanted to just say these few words. And going on the second part, well, as you know, I've predominantly worked on vaccines and immunotherapy. So, their types, the incidence of various diseases, the risk factors, the treatments, and how to combat those deadly diseases or per se prevent them. So, to be specific, these are some topics that I worked with: immunotherapy. We covered the basics of immunotherapy, like what is exactly immunotherapy, how it works, how it progresses, what are the prospects in future for immunotherapy. Then we worked with cancer vaccines to educate, like, what are the roles of vaccines in cancer, how early we can prevent cancer by getting these certain preventable vaccines with their specific dosage for every age group. Then we worked on HPV, human papilloma virus, and its vaccine, how it works, and how early is it to be preventable with certain, immunization. And then we further covered the depth of preventive vaccines, and then therapeutic vaccines, and diseases that are already in progression, and how to able to combat them by using immunization. And then finally, we touched upon breast cancer vaccines, how there's ongoing work from there, even from the organization. They're developing vaccines, that too at a low cost, so that it can be accessible again for everyone, which is worth applauding. And yes, are the few key features that we have covered in this internship. And of course, your mentorship, Dr. Shakespeare Carvalho. It's been amazing working with you. You've been patient with the guidance. You've been answering every question I had, every queries, and disseminating all the confusion. So it's been by far a very educating and wonderful experience.